the demand in this market is increasingly concentrated around things like late-stage development, tech transfer, and commercial readiness. Clients are looking to CDMOs that can adapt quickly, handle potent compounds safely, support multiple stages of development without major process changes. AI is definitely not replacing scientific expertise at all of these CDMOs, but it is helping their teams review larger data sets faster and make more informed decisions during development and manufacturing.
Hi, everybody, and welcome back to Expert Insights with Drug Development and Delivery. I am here again with Cindy DUBIN, our managing editor of Drug Development and Delivery. And as you all know, every month we do an amazing special feature. Cindy is the key to bringing all of that great information to us. So we thought we would take this opportunity yet again to kind of give you guys the highlights of this special feature so that you know what to expect, and definitely make sure to check it out. But Cindy's here today to tell us a little bit more about it. So Cindy, our June special feature is we feature Drug Development and Delivery's focus on outsourcing, formulation and development and manufacturing. And you interviewed some of the best CDMOs in the market. So can you tell us a little bit about what you found while doing this article and what people can look for?
Absolutely. This is probably our largest CDMO article. We run this feature every year, and we had great response to this. And it's no surprise because the size of our article reflects the size of the market, because according to Fortune Business Insights, the global CDMO market was valued at $255 billion last year.
Oh, wow.
It's expected to reach $273 billion this year and more than double to $581 billion by 2034. So the demand in this market is increasingly concentrated around things like late-stage development, tech transfer, and commercial readiness. This, in turn, is driving the need for formulation optimization and analytical method transfer, but earlier in the process than in the past.
Okay.
CDMOs are also seeing more programs focused on smaller patient populations and more targeted therapies, which is requiring greater manufacturing flexibility. Batch sizes are smaller, timelines are tighter, and products themselves can be more complex from a formulation or containment standpoint. Also complex is precision medicine, niche patient populations, more targeted studies, shorter recruitment windows, and frequent protocol adaptations can require greater flexibility in manufacturing and supply planning. This, in turn, is placing an emphasis toward agile scheduling, tighter batch size strategies, and robust change control. Everything that we just talked about above is now increasing the need for closer coordination between formulation choices and supply chain realities, including packaging configurations, label changes, distribution requirements that may evolve as patient stratification criteria are refined. In response, CDMO support is really not a single technology, but the capability to maintain compliance, traceability, and continuity of supply. Precision medicine is not really fundamentally shifting small molecule CDMO workflows, but it is influencing expectations around dosage form versatility. Platforms that can accommodate a broad patient population, such as suspensions for dose titration or multi-particulates that can be administered in multiple ways, are becoming more important. Clients are looking to CDMOs that can adapt quickly, handle potent compounds safely, support multiple stages of development without major process changes. It's also increasing the importance of strong process understanding earlier in development so products can scale efficiently as the programs develop. CDMOs are also increasing supporting therapies targeted to specific genetic markers, or orphan populations. This requires the ability to design complex dosage forms and to manufacture small GMP batches efficiently, sometimes on demand, and that needs to align with critical enrollment and evolving data. This changes how CDMOs think about infrastructure, planning, and quality systems because traditional models are built around long, repetitive campaigns that may not be fit for purpose. As regulators lean further into real-time data and adaptive pathways, precision medicine is making operational agility and collaborative partnerships central to a CDMO's value proposition. And finally, as we have learned, as we've gone through our conversations, Amy, there is the AI angle, and efficient program development is one reason CDMOs are turning to AI and data-driven tools. They're using the technologies to play a more practical role in development and manufacturing, such as analyzing historical data sets and informing experimental design. Current applications focus on identifying structure-formulation relationships and improving process understanding, particularly for scale-up of complex systems like spray-dried dispersions. AI is definitely not replacing scientific expertise at all of these CDMOs, but it is helping their teams review larger data sets faster and make more informed decisions during development and manufacturing. So I know that that's a lot that I threw at you, but this was a huge article and I got tons of great insight from many of the industry's leading CDMOs. And these were the commonalities in response.
All right, great. Well, listen, we encourage everybody to go to drug-dev.com and read the full special feature article. Or you can check it out in your magazine that you've got in your mailbox. Definitely check it out. And we'll be back with you next month with our next special feature. Cindy, what's our next special feature?
Injection devices.
That should be a really good one too. So make sure to go to drug-dev.com, check it out, and we will see you next month.
Thanks so much.